Good afternoon, Dr. Abraham. How are you today?
Doing well. Hi, how are you, Ramana? Thanks for
Well,
calling,
thank you. Thanks for joining the first call with us today. As we discussed, we are Easy Healthcare. We are trying to build a platform wherein we'll connect patients from across the globe with expert specialist doctors in the US. So to start off, if you could please introduce yourself a little bit, that will help us.
Sure. Well, thank you for having me on. My name's Abraham Rajan. I'm a physician in practice in the US, in the state of Texas, actually in a place close to Austin. Been in practice here in the US for just over 20 years. Finished my training in Kerala, India. Yeah, actually, Kota Medical College. Graduated in 1993, and I spent about 3 years in England after that, training in general medicine, oncology, that kind of space in internal medicine, and then migrated to the US. Okay. So I've been in practice, like I said, close to 20 years in the field of nephrology. And so I'm in a group of 8 other nephrologists. We provide care to a very large area of Central Texas, working out of about 4 different hospitals. The kinds of patients we primarily see are those on dialysis. In other words, those who have kidney failure, that need some form of intervention, either through some form of dialysis or renal replacement therapy, or people who have had kidney transplants. We also see a large number of patients with chronic kidney disease, which is the condition that, if untreated, usually leads on to end-stage renal failure or end-stage renal disease. So that's primarily our practice kind of occupation, so to speak. We have patients that we see in a kind of a wide geographic area here in Austin, north of Austin, between Austin and Dallas. Yeah. I do see some patients occasionally who are friends of mine that have questions about relatives and friends who are in India. And so I tend to kind of give some opinions, some kind of expert opinion on those questions. But that is very informal. But like I said, most of my practice is here in general nephrology, not part of faculty of a teaching hospital, but mostly private practice, dealing with most of the bread and butter kind of kidney conditions that we commonly encounter.
So interesting you brought up the point of India, because that's the sort of the focus area for us. What are some of the issues that you are seeing patients from India are asking you in terms of questions? And if they want to connect with you, how would you sort of go about it?
Yeah, well, I have a lot of friends who have reached out to me, friends here in the US who have reached out to me about relatives or other friends of theirs in India with these kidney conditions, and they would kind of want to run a clinical scenario and ask me what my opinion on that particular matter might be. So I've had patients call me about patients who have had kidney transplants, for example, in India, patients on dialysis, patients with certain forms of kidney conditions or glomerular diseases, as we call them, what we here in the US would do. And they would just basically try and compare that with the level of care that they're getting in India, And so these are purely informal kinds of things, kind of curbside consults, as we call them. They would just reach out to us over, say, WhatsApp, or just call us and say, hey, look, I want to present a case to you. And then when we ask for more information, what they do is they'll fax over or email over a whole bunch of labs and other investigative studies, and then ask us for our opinion. So I've done that. I've noticed that I'm getting more and more calls about patients on dialysis. Unlike, say, about 10-15 years ago, when this was not that common. I'm beginning to see way more patients, way more people who are now requiring some form of dialysis in India. And it's becoming more of a prevalent issue over there. So I've got a lot of not a lot, but a few people who called and asked what I would do, how I would make their experience in India better, and how would I optimize their care,
Absolutely.
So, and just as a side, I was in India recently, about 2 months ago, and I had a friend, actually a cousin, whose uncle, had to start on dialysis. I mean, he lived in Agra for a long period of time, and then he ended up developing kidney failure, then he then relocated back to Kerala. And so, I visited with him, and we talked about, his dialysis experience, what could be done to make it better. So things like that, a lot of, kidney kind of dialysis-related questions I do get posed. Some people have questions about people who have had kidney transplants, for example, things like that, So it's pretty varied,
Okay, okay, great. And obviously, the numbers have to be big in India. The population is large. Kidney,
Yes.
renal failure related issues are on the rise because of various reasons, diet being a prime culprit.
Yes. Yes.
Before potential people or patients come to you with questions through our platform, what are some of the recommendations that you would have before they actually come to you for guidance and advice?
Well, I think the first step would be to actually visit with someone locally to
Yeah,
get a sense of what might be going on,
yeah,
and to get from that particular physician, a treatment plan for the condition that they might have been diagnosed with.
right.
Now, when you present that data to us, 9 out of 10 times, we might be in concurrence with what that provider is actually, offering, or what the person is actually saying, because they are pretty very well educated physicians in India.
Sure.
I trained in that background, so I kind of know how it is,
Yeah.
and so they can't be very far off the mark. And so if we have that information and their view, we can certainly put ours in parallel to that and tell them
Yeah.
that this is also something that we might be. This is what we would do with someone in this country, for example. And then obviously there are sometimes cultural differences. There are other differences that you have to take into account to decide which would be the best way to go forward. But we can tell you what we do here, and which is considered to be standard of care.
Sure.
And this may be a suggestion that we would encourage you to take to your primary doctor or take to your specialist,
Yes.
and then have a discussion with them and see if that is appropriate.
Right. Okay. Awesome. Yeah. Spot on, doctor. I think so. In terms of next steps from our side, as we start posting these short videos on our Facebook page and YouTube page, we will be looking to funnel some of the patient-related questions to our platform. We will consolidate these questions, and in the next Q&A, we can bring up some of these questions and we can see what you have to say before we actually move on to next steps in terms of connecting directly with the potential patients.
Absolutely. I would be excited, more than happy to help,
Sure.
Yeah, absolutely. Like
Okay.
I remember telling a friend of mine who, called me one day from California saying, "Hey, I have this question about a patient. Do you mind giving an opinion?" I said, "Look, of all the things in the world, the one thing I like doing the most is giving an opinion, I will opine and opine freely, So I have an opinion on everything in the world, but this time, if it's something related to
Yeah.
something that I've done for so long, I'd be happy to give my opinion, with some level of kind of ground-based reality, reality and knowledge.
Right. Right. Okay. Thank you so much, doctor. Thanks for your time today.
Okay. Hey, not a problem. Thanks again. Bye.
Good.